A recent study, as part of the ORCHESTRA project, identified the clinical characteristics and risk factors associated with long COVID-19 syndrome. The study was carried out across 5 countries and involved 1,796 patients. These patients were monitored at 3, 6, and 12 months after their diagnosis. Of the patients enrolled, 1,030 experienced at least one symptom at the 12-month mark. The researchers used questionnaires to assess changes in the patient's quality of life index over the course of the follow-up, using machine learning and federated learning. They identified 4 distinct clusters of symptoms: chronic fatigue-like, respiratory, chronic pain, and neurosensorial symptoms. According to the study, the primary risk factors that increase the risk of severe long COVID syndrome include being female, experiencing gastrointestinal symptoms, and having renal complications during the acute phase of COVID infection. Being female was associated with an increased risk of chronic pain, neurosensory symptoms, and chronic fatigue-like symptoms. The most significant reduction in quality of life was observed in patients exhibiting respiratory and chronic pain symptoms. Conversely, SARS-CoV-2 vaccination, early treatment of the infection with monoclonal antibodies, and corticosteroid therapy for severe cases offer protection against long COVID syndrome. These findings could assist in shaping pathogenesis studies and identifying high-risk patients for inclusion in therapeutic and management-focused clinical trials.